Hi, I'm Lindsay Mercer, and I am the Program Director for Cardiac Sonography at Jackson College. There's a desperate need right now for healthcare workers, not only in Michigan, but our surrounding states and countries. So our goal is to help fill those voids and support our communities. We go through a rigorous process every 5 to 10 years with our review process through our accreditors, and that assures that we are meeting the standards of the profession. So when you graduate from our accredited programs here at Jackson College, you are entry level and ready to enter the workforce. Also, we position ourselves a bit different from other programs around the country. We are one of 2 accredited online programs in the United States for cardiac sonography, so that sets us apart from other programs. So our cardiac sonography program is a second admit program at Jackson College. We require students to complete all general education and related prerequisite allied health courses prior to admission in our program. Intro to health occupations, medical terminology, general physics course, intro to sonographic principles, and intro to diagnostic imaging as well. Our program consists of 12 months of clinical, didactic, and lab courses. Some taken here at the campus and others taken online as well. We accept applications 1 time per year. Students go through an interview and an application process, and that is available online to review. Students are competitive against others that are applying to the program. Roughly, it's based on GPA, previous credit earned through courses taken at another college or university, credit for prior learning, so if you've worked in allied health or if you have an allied health degree, we offer additional points for that as well. We take a really hands-on and personal approach with all of our students. We know all of our students by name, we meet with them regularly, and this is a big investment in the student and also in our community and our surrounding communities as well. Your career prospects are a bit unlimited in this career, which is nice. This career can fit your personal lifestyle. If you're wanting to work full-time, you can certainly gain full-time employment. But if you're maybe a person who just wants to work part-time, if you have a family, there's a lot of part-time opportunity as well. The profession can host jobs in hospitals, in outpatient clinics, in research, doctor's offices. There's lots of opportunity in education and lots of opportunity in sales as well. Students attend courses over the course of 3 semesters, and that is in combination of the first 9 weeks would be a lab course that they would attend along with their didactic course. The lab course is an in-person course that the students will attend here at our central campus for the first 9 weeks, and then they'll also be doing online classes as well. The 3rd month into the program is when the clinical rotation begins, and the clinical rotation is the long rotation that lasts the remainder of the program. This entails around 1,140 clinical hours. Those hours performed in one of our clinical affiliates, learning on the job training essentially. So the students during clinical learn how to operate equipment, learn how to scan patients, learn how to apply all of the bookwork they learn over the course of the semesters to the patient exam, and how to become a allied healthcare worker. We are looking for students who are strong in science and math, students who can communicate effectively, because as part of the healthcare team you have to be able to communicate very effectively with a variety of people, your patient and your healthcare staff. Students that have good technical skills. There's a lot of technical skills that come in with operating ultrasound equipment, so we're looking for students with those capabilities. We're also looking for students who like to investigate, like to solve puzzles, and pay real good attention to detail. I'm available by email daily. Please feel free to email me at lmercer@jccmi.edu. My office phone number is 517-796-8529. I welcome emails and phone calls all day long.